Well, it's time once again to visit with the folks from the Apple organization here in Addison. Apple is the Addison Partners for Play, Learning, and Education. And joining us once again is Mary Haley, the project director with Apple. Hi, Mary. Good to see you back again.
Thanks for being with us again.
Yep. You've brought another one of the partner agency representatives, and I'd like to give you the opportunity to introduce the young lady that's with us here today.
I would love to. Thank you so much. This is Joanna Romero with Hamdard Health Alliance. Joanna has been in her role for almost a year now, and Hamdard has been a partner of ours for many years.
Okay. Well, Joanna, welcome. You've been working with Hamdard for several years now. For those who are not familiar with what the Hamdard organization does, the services that they provide here locally in the community of Addison, tell us a little bit about what Hamdard does.
Well, thank you for having me.
Sure.
So we are Hamdard Health Alliance. We just celebrated our 30th anniversary.
Oh,
wow. What we provide is medical services, mental health services, supportive services, and outreach and advocacy. So we're a FQHC, and what we are trying to implement is spread the word of our services. We focus on helping the community, especially for the underserved. There's a lot of people that don't have insurance, and we have resource navigators at our location that can help you apply for public benefits in-house.
Can you define, you used a term
there?
Federally
Qualified Medical Center.
Federally Qualified Medical Center,
Right.
FQMC, is that right?
FQFC.
FQFC, okay, very good. So obviously you're receiving resources from the federal government,
Yes.
and that is service delivery then that happens locally then?
Yes.
It happens in a community?
Right.
Okay. Oh, describe a typical client then that comes to Hamdard.
So right now, I've joined forces with the school district here in Addison. There's a lot of children that are coming in that are refugees to our country, and they're not insured. They don't have resources. So what we do is bring these little guys.
Sure, yeah, information.
And inform them that they're welcome to come in. We don't ask questions, doesn't matter of their status here in the US. We would like to help. I think it's very important for them to be healthy. So we're doing school physicals for the children that are coming in new, doing vaccines. If they don't qualify for public benefits, we have a sliding plan. Depending on their income and dependence, they qualify for a lower fee. If the parent is currently not employed, they automatically qualify for $25 an hour. $25, I'm sorry.
Okay, $25 flat fee.
Yes.
Okay. What are the challenges that you have today versus 5 years ago, let's say, of your clientele? Cultural, language, people who just are unsure where to reach out, which is why you have partnered with Apple, and compare it to what it was like some years ago versus where we're at today. You talked about immigration status, for example. You know, are those some of the challenges,
Yes.
the struggles that you have
Yes,
versus years ago?
Finding someone that speaks the language, bilingual.
Okay. Mm-hmm.
And we're not very known out there. I used to live locally here in Bensonville, next door neighbor, about 6-7 years. I never knew Hamdard existed. I came across them through Indeed, and I applied for the service. Ever since then, I've been dedicated. I started as a PSR, and I feel that our mission here to help the community and the underserved is really what we're dedicated to do. And I think that spreading the word and making people aware that we're here to help them genuinely, I think that it would bring more, information for the community and for the help that they need.
You said helping people genuinely. Is there a stigma to providing these types of services? Are people still leery about this? Is there a wall of separation between what you're trying to do versus the greater community, the people who might need the services?
Yes, absolutely. A lot of people are afraid that we will tell the police that they're coming for help. They're afraid to open up to the community because they don't know if they're being sincere for the help. And we were just talking about this in the meeting with the group yesterday, that a lot of parents are afraid that they give the information, the staff in Addison schools, and they don't call or they won't do it because they're afraid. They don't think it's genuine. And again, are here, I firsthand grew up as a minority and not speaking the language. I had to translate for my grandma and my mom, and I firsthand know what that was. It was very challenging. Some of the words that the doctor or pharmacist or whoever I was translating with, I had no idea what they were saying, but I would keep it straight to the basic stuff that I did understand. And I firsthand know how that felt. So I genuinely come here and say, we're here to help.
Mary, this reminds me of a discussion I had with the folks at the Henry Hyde Resource Center last year. And their staff said it's very difficult when a child has to go with a parent. The child might be able to manage some language, some English, but the parent doesn't. And the parent would like to be able to advocate for themselves. They should be able to, with, let's say, medical care. And the child has to be the interpreter for something that I think, as Joanna just said, I didn't understand what those words meant, and I'm there trying to help my mom or dad with something as basic as healthcare. That's a really tough problem to have, that the kids have to take on the role of an interpreter for something that really I think parents would want to be able to do on their own. Would you agree with something like that?
I agree with both of those points. I think it's tough for the kids. They certainly want to help their parents, for sure. There's no question about that. But that's a pretty heavy ask of children, to be in that role and to be the communicator in between, someone that's providing services and their parent. And at the same time, I know that parents are uncomfortable needing to rely on their kids. It's not the situation that they would prefer, but it's reality and it's what they need to do. So it is tough, but I think too that there is a lot of dedication on the part of families in this community. So children want to be helping as much as they can, and parents know that they need to do what they need to do to access services at times. But yeah, it's a tough challenge.
Now, Hamdard has been with the Apple agency and the entire collaborative for many years, about as many years as you've certainly been involved with them. Is this one of those kind of core basic services? We've talked about school services, we've talked about healthcare, we've talked about library services, literacy, and so on. This sounds like it would be kind of a core mission then of the Apple organization, and Hamdard is there to fill that role at the collaborative, so they're getting the clients who need the help over to their organization.
Absolutely. And what we're trying to do big picture, and we've mentioned this before, Don, it's the concept of in education, it's referred to as the whole child. And in our world, it's referred to as the whole family. So our focus is early childhood care and education, but we also want to be bringing partners to support families in all realms that kids would need support. And obviously medical care is a key. Medical care and healthcare is a key need.
Yeah, you don't want to silo off the family. I mean, we have enough silos within the many layers of bureaucracy we have to deal with on a day-to-day basis. The last thing you want to do is silo off a family and say, well, the kids can get the help, but the parents certainly can't. Exactly. And the parents need to be healthy for the kids.
Yeah.
Right?
Absolutely.
It gets to be almost, you got to wonder why something like this can be a problem from time to time.
Yeah, and it's really critical too. Joanne touched on this a little bit. Joanna touched on this a little bit. Sorry about that. The trust factor is everything. So when our partners meet on a regular basis, when we just work on projects together, we're building good relationships. And then as we're meeting with our families and building trust with our families, whether it's Rosa Galvez or Joanna or one of our other partner contacts, as we do referrals and make recommendations that families get in touch with other partners, they can trust that we're giving recommendations in their best interest. So it kind of goes full circle.
So Joanna, let's say someone comes into the Hamdard Center here in Addison and they have made a connection, perhaps through the Apple organization. What are some of the first things you need to find out from them as far as an intake would go? How do they come in to the Hamdard Health Alliance, brand new, first time, may have a language barrier, may have some other issues? they're not quite sure of their own health status themselves because they haven't seen a doctor for years, let's say. So what are some of the things you first have to deal with to try to get them through an intake and onboarding process so they can become part of the services that you provide in the community?
So first off, like you said, it really depends on what the service they're seeking. Second, we have to ask if they have insurance. If they do not, we have to make sure that whether or not they'll qualify for public benefits. Children underage, I'm certain that they would, but most of the time parents don't. So that's where the sliding plan comes in. We have a sliding plan depending on their income. So if they need a medical appointment or a school physical because the school is requiring it before they start school, again, depending on, it could go either way, or they sometimes seek behavioral assistance. Right now we have counselors, but they only see children 10 and above. We actually just brought in our team a psychiatrist that is seeing children 14 and older. Okay. So that's something the CEOs actually informed this to the district, so I'm pretty sure that's going around in emails. Again, it really varies. If they need food, we have a food pantry. If they need hygiene items, we have that as well. Right now we have partners with Addison Library, and they donate books to us, which we donate to the patients. But again, it really depends of what they're coming or what service they're seeking. But again, we try to schedule them as soon as possible. If we're not able to schedule them, we partner up with DuPage County, other locations that offer the same services. We don't think about competition. We're here to serve the patient, and if we're not able to do it, then we'll refer them somewhere else.
When you talked about the sliding scale for the people who do not have insurance, is it because of the federal grant dollars that are coming in that your clientele, there needs to be an assessment process? It's means tested, basically. If the person doesn't have the ability, they don't have the income, they don't have the insurance, there could be services available, but that has to be vetted first.
Right.
Okay.
But whether or not they can pay, we can't deny services. We won't deny services. We will see them. Yeah. Everybody has a different situation financially, and I think this is where we come, and this is where we stand out of other clinics where we're here to serve, and if you are not able to pay, you're still going to be attended.
Is this a relatively new concept in healthcare delivery? We get bombarded with, it used to be you went to the doctor. Yeah. That was pretty much it. You had what they used to call general practitioner doctors, the family doctor. And then, of course, with the cost of healthcare rising just, explosively, corporate America took over, and now healthcare is really run as a corporation. But that didn't fit everybody's model for needing healthcare. So is this a relatively new concept to have a community-based approach where anybody who needs that, who doesn't have the means otherwise financially, can access that? This sounds like it's a newer concept in delivery of healthcare.
I agree. Yes. Again, personally, my husband has our insurance, and he's paying more than $500 every 2 weeks for our family insurance. Yeah. It's expensive, and some people can't afford that. I grew up having public aid, and I know firsthand how it felt to be mistreated because of what insurance I had. We don't implement that at Hamdard. We come, help, and support, and if we can't help you, we'll refer you somewhere where they can. Yeah. Everybody's treated equally with respect.
Right. Yeah. We don't need that to be as I said, the stigma of society on top of everything else. Talk about the staff that you have there. You talked about a psychiatrist coming on board now. So give us an idea of who works at the facility, for example, here in Addison.
So right now in our Addison location, we have a medical provider. Her name is Irma Esposito. She's MD. She is Colombian. She speaks Spanish, so she is able to communicate. Easy.
Oh, that was a good find for you folks. Good.
Yes. We have a Valerie Vell. She is she speaks Spanish too, so great. Okay. We have counselors. Currently we have 2 bilingual, one that speaks Urdu, And our newest psychiatrist, it's only English, but we do have a service for different languages that we use for when there's patients that we don't have the language or the staff that's available to translate. We have someone in our office that speaks Arabic. What else? Polish. But if we have a unique one that we're not, then we have the line that we call, and we have options.
Well, I forget what the statistic is at the District 4 schools, but how many languages? Do you happen to know, Mary, offhand, how many languages that are represented within the public school system, for example? In
I don't know that accurately, but I can say that it's for sure.
Dozens.
Yeah, I was going to say several dozen.
Yeah. So there you go. I mean, why have people who speak Urdu and Arabic and on and on? Well, because that's going to be the clientele that you're going to be seeing.
Right.
Mm-hmm. Is it a walk-in facility or appointments? What's kind of the mechanics of how it works?
Because of how our schedule works, we usually do appointments.
Okay.
Again, if it's something urgent, we do recommend the patient to go to immediate care, or again, it's based.
Does your doctor see people on a regular basis? In other words, would somebody come back there for a follow-up treatment? Okay.
Yes. This provider, Dr. Esposito, she actually brought patients of her because they were loyal to her and want to continue seeing her. She's really great at what she does.
The patients that come in then to the facility, imagine at first it's very scary, it can be intimidating, anything like that could be. What do you see then as a difference from the time they come in versus when they've seen somebody, they've been able to communicate the issues, they feel a bit more relaxed, they know that somebody is there to help them, that they are going to, they're not going to be judged, they're going to be cared for as a human being. Can you make a differentiation between the two when they come in versus when they actually are able to receive care? And how does that look? You talked about your own personal experience, so I would imagine a lot of people probably have a story similar to your own.
Right. So I started as PSR, which is a patient service representative. So I firsthand worked in the behavioral department, so I can honestly say for the Latino community, they don't believe in counseling. They don't think depression is a health issue. Oh, wow. Yes, they don't accept that. So when the schools recommend for the parent to bring the child to a counseling session, they're very iffy about it. They're very, the children don't want to come. Why do I have to do this? Like, I don't want to. But then I firsthand witnessed when they first came and the after, and wow, what a difference. And it has opened up a lot of other parents, word of mouth. Well, I already brought my son and this is what's happening. And so they recommend more people and it's starting to spread. But again, it's sad that they don't believe in that. They think that, no, walk it off. You'll be fine.
See, that's unfortunate that happens, because we have learned in the last several years that behavioral health, not only is it critical for the adult community, it's needed in the adolescent community and younger. And that says a lot. And if you're going to deal with it on the front end, not the back end, where it's more costly and there's more challenges to deal with at that point.
Yes,
Very
agreed.
Interesting. Yeah. Word of mouth, is that a good way? Is that how people find out about what you do? I would think so.
Absolutely. When I go to Mary's meetings, oh, Joanna, you're Joanna. I've heard so much about you. And again, I just started this position. From all the positions I've had, this is by far the best. I found what I was meant to do.
It has to be very rewarding for you personally. It is.
Again, I'm not there just to do a job. I'm there because I care and I want to make a difference and I want to be able to help. It's just, it feels great. It's an amazing feeling when something happens and it's rewarding to me.
I can tell. I mean, really, it's amazing. It is. You're certainly a great spokesperson for it, and you're certainly delivering services that are going to be needed in this community by a lot of people. Joanna, if you would please, how do people reach out to Hamdard Health Alliance here in Addison, what is the best way to make contact with you?
They can Google us, Hamdard Health, and we have a website there. You can request for an appointment. You do have the option to change it to Spanish or other languages.
Online, so you can do it right then? Oh, that's good.
And then someone will call you back. There's the option of what you're seeking, if you have insurance, and preferred language. And then that comes to an individual, and that individual scatters where it has to go.
So the more they can do online initially before coming in, the better.
Right.
When they get there, there's less, we used to call it red tape, but there's less stuff they have to do when they come in. They want to get there for the services, not to be filling out a lot of paperwork.
We also have that online. So we give you a QR code, and you can register and do all the documentation prior to coming to the office.
Well, that might be where the kids have to get involved because they're a little more tech savvy, right, Mary?
Exactly.
Yes. We have come across patients that don't read and don't write.
Okay.
But we as the staff are happy to help them complete it if needed.
Right. Very good. So it's Hamdard Health Alliance, located here in Addison, 228 East Lake Street.
Yes.
Their phone number is 630-835-1430, or you can reach them online at hamdardhealth.org. Mary, before we wrap up, first of all, this is just amazing to have this service available in the community, because it must help you do your job, make your job a little easier than knowing that you have this type of health service available in the community.
There's no question about it. And we know that if we have a family that comes to us, or if one of the social workers from the school district comes to us and needs support, we know that if we reach out to Joanna or one of her colleagues, they'll be so responsive. So it's a good feeling knowing that when we're in the middle trying to help a family and we reach out to them, we know that we're going to get help right away.
Yeah. And you're able to meet with them, you're able to find out what's happening in their agency, which helps you then kind of promote what they do, but at the same time, you're able to communicate back to Joanna and her team and say, this is going to be an issue now coming up, because you're in contact with the school system, particularly at District 4, locally, to let them know what you're hearing kind of on the ground with operations in the schools.
Exactly.
Yeah,
that's what we're all about, having these relationships going on all the time, so we're prepared.
Okay. You have an event coming up, Mary. It looks like it's coming up pretty soon. So do you want to give us a word about that and how people can get involved and learn more about what you're doing with the Apple organization? Sure.
It's actually an event that the Addison Public Library is doing with some partners, and we're a part of it, as is a few other organizations in Addison, like NEDSRA. There's a Care Con event. It's going to be on February 18th from 1 to 4 in the afternoon at the Addison Library, and it's all about mental and emotional wellness. So kind of timely given what we were just talking about. There are going to be yoga sessions. School of Rock is going to be there. We'll have the DuPage Children's Museum there doing a pop-up for the kids.
You've partnered with them before too.
We have partnered with them before as well, and NEDSRA will be there with a sensory activity. So there's going to be several different types of activities and sessions. It's going to be all about movement and music and learning about self-care.
So people can actually come and take part in this. This
Absolutely.
isn't where you go and just people hand you a flyer and go, here's what you can actually be a participant in this at the
absolutely.
same time. Okay.
Yeah, so we're also going to have an infant toddler mental wellness specialist that will be there doing a couple of sessions. So all of these interactive sessions will be going on from 1 until 4. Again, it's on February 18th at the library.
Pre-registration required? Or just
no,
walk
it's
in?
not required.
Okay, free event.
Yep.
Very good. All right. Mary Haley, the project director of the Apple organization. Thank you. And Joanna Romero, the community relations lead for Hamdard Health Alliance here in Addison. Thank you so much. Your story is inspiring. It really is. And the things that you're doing in the community through the Hamdard Health Alliance is a great benefit to the people of Addison.
Thank you. Thank you.
Thank you both for being with us today.
Thank you so much, Don. Appreciate it.